Are you familiar with the term blue balls? I'm Dr. Rena, a urologist and pelvic surgeon, and today I'm going to walk you through everything you should know about it. Is it actually real? What can you do if it happens? And is it something dangerous? So, blue balls refers to a feeling of pain, discomfort, heaviness, or a dull ache that men may notice after a long period of sexual arousal without reaching orgasm or ejaculation. In medical terms, this is known as epididymal hypertension. Now, where did this phrase even come from? The exact origin isn't very clear, but we do know it has existed in everyday conversation for many years. Even so, there's surprisingly little medical research on it. There is one case report published in 2000 titled Blue Balls, a diagnostic consideration in testicular scrotal pain in young adults, a case report and discussion. It describes a 14-year-old boy who went to the emergency room with intense, sharp, stabbing, constant pain in his scrotum. The pain started suddenly and lasted about an hour and a half. When I hear symptoms like this, I immediately think of something called testicular torsion. Testicular torsion usually affects young boys or teenagers and is considered a medical emergency. It happens when the testicle twists, cutting off its own blood supply. As I mentioned, this requires urgent surgery. You have to untwist it quickly to restore proper blood flow. After the doctor spent time speaking with the boy, he learned that a similar episode had happened a week earlier. The boy had experienced almost the same kind of pain right after some sexual activity, and it lasted about 2 to 3 hours before going away. When the pain returned this time, he had been engaging in foreplay with his girlfriend, kissing and touching, and in both situations he did not reach orgasm or ejaculate. The pain began shortly after the activity stopped. In the end, the boy recovered well. He was observed in the emergency room, and the symptoms resolved on their own. Because of this case, the author suggested that this is something worth discussing, mainly to ensure that more serious conditions are ruled out. Even after that publication, however, there still hasn't been much research on the topic. What we do understand is that the sensation often described as blue balls may be due to a buildup of blood in the testicles and pelvic region during sexual arousal. During arousal, blood flow to the penis and testicles increases, which can make the testicles slightly larger and firmer. If that arousal continues without release through orgasm or ejaculation, the blood eventually drains away, but it can leave behind a lingering feeling of heaviness or discomfort in the genital area. It doesn't mean the testicles actually turn blue. However, the blood that drains from the testicles through the veins is deoxygenated. This simply means the blood has already delivered oxygen to the tissues there, and as it returns back to the heart, it can appear slightly bluish in colour. More likely, though, the term blue balls comes from the idea that blue represents feeling down or frustrated, which fits the experience many describe. Interestingly, this isn't something limited only to men. Women can experience a similar condition, sometimes referred to as blue vulva, when they are aroused but do not reach climax. If this happens to you, there's no need to worry, it isn't dangerous. But if you want to ease the discomfort of blue balls or blue vulva, you might consider masturbation or another way to achieve climax. You can also try lying on your back and shifting your focus to non-sexual thoughts. Applying a cold compress or taking a cold shower may help as well, since cold causes blood vessels to tighten and can reduce blood flow to the area. Even straining, like when lifting something heavy, might help redirect blood flow. For the discomfort itself, warm compresses can be soothing. If it feels quite uncomfortable, over-the-counter medications like Tylenol or Motrin may help. In most cases, though, the sensation fades on its own. If you notice that the pain continues long after arousal has ended, it's important to speak with your doctor. And if the pain is severe or not improving, going to the emergency room is the right step. So, that's blue balls explained in simple terms. While it can feel uncomfortable or even painful, it's not a serious medical issue and usually resolves on its own. If you're finding this content helpful, be sure to subscribe and share this channel with your friends so more people can access reliable, evidence-based health information. And as always, take care of yourself, because you truly matter.